Pulmonary function tests are a set of non-invasive tests that measure how well your lung work. They assess lung volumes, airflow, gas exchange, and respiratory muscle strength to help diagnosis and monitor lung disease. Lung volumes are and capacities are measurements that describe the amount of air in the lungs during different phases of the breathing cycle. They are crucial for assessing pulmonary function and diagnosing respiratory conditions. Vital capacity is influenced by several physiological and environmental factors that affect lung function and respiratory efficiencies. For example, young individuals tend to have higher vital capacity due to better lung elasticity. Male generally have larger lung volumes and high vital capacity to compared to female. Taller individuals usually have larger lung capacities, and athletics have higher vital capacity. Vital capacity provides a key insight into pulmonary performance and disease detection. Pulmonary function tests have several important goals in diagnosing, monitoring, and managing respiratory conditions. Spirometry is a pulmonary function test that measures airflow and lung capacity. The flow volume loop consists of two phases, expiratory phase and inspiratory phase. A normal curve has a smooth, symmetrical shape with a sharp peak followed by a gradual decline. Spirometry interpretation involves comparing lung function results to predicted normal values based on age, gender, height, and ethnicity. Acceptable criteria for pulmonary function tests include the patient must inhale fully and exhale forcefully, no hesitation or interruptions during exhalation. Exhalation should last at least 6 seconds. And repeatability. Repeatability is at least three acceptable maneuvers with FEV1 and forced vital capacity within 150 ml of each other. No artifacts, no coughing, leak, or glottis closure during the first second. And also, they should have a proper start and a proper end, no false starts, and a clear plateau at the end of exhalation. Unacceptable criteria include incomplete inhalation or weak exhalation, coughing in the first second, early termination, variable effort, leaks or obstruction, and extra beats. A normal spirometry test typically includes FEV1, FE F2575, and FE1 over forced vital capacity. In obstructive lung disease, airflow obstruction due to narrow airways making exhalation difficult, so they will be reduced if EV1 over forced capacity ratio, and this will confirm obstruction. So if EV1 over forced vital capacity decreased to confirm airway obstruction. In restrictive lung disease, reduced lung expansion leading to decreased lung volume, making inhalation difficult. So we will have normal or high FEV1 over forced vital capacity ratio with decrease in forced vital capacity. This slide shows the interpretation for obstructive and restrictive lung disease, and you will find the F forced vital capacity, FEV1 forced vital capacity, FEV1 over forced vital capacity ratio, and what is expected in both obstructive and restrictive patterns. Again, this slide is another explanation for the interpretation of forced vital capacity and FEV1. This slide also shows us interpretation of FEV1 over forced vital capacity and FEF 25-75%. Measurements of total lung capacity, residual volume, and FRC is not done by normal forced vital capacity or spirometry. We need more advanced methodology such as nitrogen washed-out methods or helium dilution methods or plethysmography methods. The helium dilution method is in a pulmonary function test. It is used to measure residual capacity, and it is the volume of air remaining in the lungs after normal exhalation. It is a closed circuit technique, relies on helium gas to determine lung volumes. Total body plethysmography is a pulmonary function test, measure lung volumes and airway resistance using sealed chamber, provide precise lung volume measurements including functional residual capacity and residual volume. The nitrogen washout method is a pulmonary function test used to measure functional residual capacity, the volume of air remaining in the lungs after normal exhalation. It is a multiple breath technique that relies on nitrogen elimination to determine lung volumes. A flow volume loop is a graphical representation of airflow during forced inhalation and exhalation. It helps diagnose and differentiate obstructive and restrictive lung disease. By this, we end pulmonary function test. Thank you for listening.